we have what we've kind of, I believe we both discussed this before, sort of the sexual function triad, we can call it. So you have organ function. This is blood flow, erection, lubrication. Basically, is blood getting to the area? Is the organ functioning properly?
Yep.
Then you have number 2, which is the desire. And this is sort of what I think of as being dopaminergic, or the drive, the want to have sex. And then you have your third portion of this, sort of imagine it as a triangle. And that's the parasympathetic response. So the ability to relax. And this, I think, comes more into play when you're looking at things like anorgasmia.
There are some things that I know, at least I've mentioned on podcasts multiple times before, some of these medications are approved for hypoactive sexual disorder. So again, like you were mentioning, what the heck is hypoactive sexual disorder? That could mean a very different thing depending on who your spouse is or who you are.
Yeah, and this is one of those cases where, again, we've used this line previously. CBT is always the right answer. There's nothing wrong with couples therapy or sex therapy, and actually, when you combine that with testosterone, for example,
yep.
You tend to see better outcomes than if you do one alone. So, like all things, there's multiple facets to approach it from. So we have what we've kind of, I believe we both discussed this before, sort of the sexual function triad, we can call it. So you have organ function. This is blood flow, erection, lubrication. Basically, is blood getting to the area? Is the organ functioning properly?
Yep.
Then you have number 2, which is the desire. And this is sort of what I think of as being dopaminergic, or the drive, the want to have sex. And then you have your third portion of this, sort of imagine it as a triangle. And that's the parasympathetic response. So the ability to relax. And this, I think, comes more into play when you're looking at things like anorgasmia, or where people are not able to kind of unwind or unplug from their day-to-day lives and get into, the mood.
Yeah, certainly. There's a lot of tug of wars that come to play in sexual health. So having optimal sexual health is not really, just hammering this one mechanism more. It's really more like teeter-totter, and you're taking things like dopamine and prolactin and trying to have a healthy balance between those two. Taking things like serotonin and dopamine and having a healthy balance, it's important. And by the way, a lot of these things, when you're talking about function, you're talking about lubrication, you're talking about tissue erection. It's both in males and females. The anatomy is different, but there is certainly erectile tissue, a relatively equal amount of erectile tissue, just in different places in males and females. And then obviously lubrication as well. I know at some point we've touched on foreskin and circumcision, and we've kind of teased a future podcast that will be more exclusively on that. But that's certainly a mucous membrane, a potential mucous membrane, I suppose. When it comes to dopamine and prolactin, we briefly talked about premature ejaculation versus delayed ejaculation. A lot of that balance actually has to do with serotonin and dopamine. And in other countries, I know we've gotten a lot of questions about duloxetine, different fast-acting SSRIs that, to my knowledge, are still not approved in the United States. Right. But they are in other countries. So we'll briefly touch about some of those things in the future as well. However, the concentration of today's podcast is more on the optimization of function, or correcting a suboptimal function. So we'll talk a lot about dopamine agonists. We'll talk about alpha adrenergic antagonists. We'll talk about your PDE5 inhibitors like Viagra, Cialis, the generics, and some other things like Vyleesi or bremelanotide.
Yeah, I think that's a great overview, kind of giving people a table of contents.